All right, we're going to continue with the personal qualities unit, and we're going to talk about healthcare team and teamwork. So what you'll learn from this lesson, you will be able to recognize the need for teamwork in medical facilities, list characteristics of effective teams, identify strategies for conflict resolution.
Healthcare team.
All right, healthcare teams. Every employee at a healthcare facility is a member of a healthcare team. Some members of the team, such as nurses and therapists, work directly with patients. Other members, like billing officers and housekeepers, have very little contact with patients. But all members of the team must work as a cohesive unit to provide the best possible health care for patients. All right, check your understanding. Question 1. Every healthcare worker is a member of a team. All right, effective teams. Healthcare teams are organized to care for specific needs of patients. For example, a hospital may have a team of surgeons, a team of pediatric nurses, or a team of administrative officers. In order to provide patients with quality care, each team must function properly. The following list contains characteristics of effective healthcare teams. Mutual respect. Team members must have respect for each other. Respect must be given to the various opinions, contributions, and expertise of all team members. Hurtful criticism is never appropriate. Respect also includes being considerate of differences in ethnicity, culture, age, gender, lifestyle, or economic status. Healthy interpersonal relationships. Team members must make every effort to get along and to create healthy relationships. This includes being cooperative, supportive, honest, and responsible. Open communication. It is important that team members feel free to express their opinions. This involves using suitable verbal and nonverbal communication. Likewise, team members must be attentive listeners when another member is speaking. Effective teams continue. Additional characteristics of effective healthcare teams include frequent conferences. Conferences or meetings are used to keep all team members aware of a patient's status. Conferences are also used to outline the duties of each team member and establish goals. Effective teams must hold frequent conferences and encourage open discussion. Team identity. Every team member must perform tasks with a sense of team identity. Team identity is recognizing oneself as a part of a whole and working toward a common purpose. This sense of identity allows the team to collaborate, to solve problems, and respond well to emergency conditions. Positive interactions. Healthcare workers must remain positive in their interactions with teammates. This requires hard work and dedication because it is not always easy to be encouraging and optimistic. Even though these traits may not come naturally, team members must commit themselves to show patience, open-mindedness, and professionalism in all interactions. All right, check your understanding. All healthcare workers should express their opinions appropriately. True or false? True. Question 3. Recognizing oneself as part of a whole and working toward a common purpose is called respect, team identity, or communication. Team identity. Question 4. Effective healthcare teams have frequent conferences. True or false? It's true. Okay. All right. Conflict resolution on a team. Team members are bound to have different opinions from time to time. Conflicts are natural and do not indicate that a team is unsuccessful. However, the difference between an average and an excellent team is how they resolve conflicts. There are several strategies for conflict resolution. Some strategies use a more positive approach, while others use a more negative approach. The more negative strategies, such as a boss dictating a solution to a conflict, generally have winners and losers. The more positive strategies involve compromising, where both sides win to some degree. Compromise is negotiating to reach a mutual agreement. Using positive strategies is more desirable in the long run, but negative strategies are not always bad because they provide a way to quickly resolve time-sensitive conflicts. Regardless, one central aspect needed for most conflict resolutions is open communication. Without open communication, an understanding of the underlying issues and resolution is not possible. All right, conflict resolution strategies. There are 5 general strategies of conflict resolution. They can be referred to as avoidance, accommodation, forcing, compromise, and collaboration. Avoidance strategy is when a person basically ignores a conflict. This is the quickest way to resolve a conflict. This strategy can only be successful if the issue causing the conflict is trivial and not worth the effort. However, if this is not true, then avoiding the conflict may actually lead to a more serious conflict in the future. Accommodation. Strategy is when a person withdraws from the conflict and agrees to the wishes of the other people involved. This strategy should be used when a conflict needs an immediate resolution, the issue is of lesser importance, or the person needs time to think more about the situation. Like avoidance, this strategy may only be a temporary solution because the root cause of the conflict still exists. Forcing strategy is when a person decides their position must prevail in a conflict. Since this strategy imposes a resolution on others, it should only be used as a last resort. This strategy can be used to quickly resolve a conflict if the person has the authority to impose their decision. However, in the long term, relying on this strategy can create resentment in a team. Conflict resolution strategies continue. Compromise strategy tries to find a solution that partially satisfies each person. Since each person partially get what they want, it is a more positive strategy. Additionally, it can provide a rather quick resolution to a difficult conflict. This strategy is a way to build more team trust while trying to find a longer-term solution. Collaboration or win-win strategy identifies the needs of each person and the root cause of the conflict. The people then work together to investigate multiple options and find a common solution that meets everyone's concerns. This strategy is the best long-term solution to any conflict. It also builds the strongest team by reinforcing a high level of mutual trust and respect between individuals. Unfortunately, this strategy is the most time-consuming. All right, check your understanding. Conflicts indicate that a healthcare team is ineffective and unsuccessful. True or false? False. Conflict resolution strategies that use a more positive approach require superiority, stubbornness, compromise, or criticism. Compromise. All right, so effective teams exercise. Let's see there. So you're going to place the items in the correct category. Okay, blames others for problems. That would be ineffective teamwork. Be negative, ineffective. Compromise, effective. Be professional, effective teamwork. Criticize others would be ineffective. Insist on doing things your way would be ineffective. Ignore conflicts would be ineffective. Listen attentively, effective. solve problems as a team, effective. Ignore personal weakness would be ineffective. Respect the roles of team members, effective. Create a sense of team identity, effective. Okay, mentorship. A mentor is an experienced healthcare professional who trains and counsels other healthcare professionals as part of a mentorship program. Most often, they mentor new professionals or professionals who might be changing careers or positions. In addition to training and skill development, the goal of a mentor is to provide their mentees emotional and social support, advice on work life balance, networking for new opportunities, and career planning guidance. A quality mentorship program is another way to help your team build positive relationships. Developing a positive relationship with someone who has experience in your field can be an essential part to your professional development. Additionally, the opportunity to work as a mentor can be both professionally and personally rewarding. Mentors need to be effective coaches. Good communication is imperative to a positive mentoring relationship. All right, lesson summary. In this lesson, you identify characteristics of effective teams. In this lesson, you learn that all members of the healthcare team must work as a cohesive unit to provide the best possible care for patients. Team identity is recognizing oneself as a part of a whole and working toward a common purpose. And compromise is negotiating to reach a mutual agreement.